So you gave a little bit on the after effects of the pandemic, maybe. But do you have any other predictions? What will be the new norm once I want to say officially say it's over, but specifically with the pandemic, what do you think the new norm will be and the effects on generations for each generation?
Well, when you talk about in terms of mental health, so we already have people in our communities who are struggling with mental health issues, whether it be mental health symptoms or mental disorders, substance abuse disorders. We already had a serious problem, right? And so because of the pandemic, we're all working from home. So I think we're going to see more of that. I think we're going to see a continuation of people opting to work from home, employers opting to allow employees to work from home, and there's going to be a lot more, which is going to in turn lead to more isolation. And so increased isolation is going to mean that we're going to have splinters of people all over the place who need help and may not access it because it was already difficult, right? It was already difficult to access it for whatever reason. Maybe people had reluctance, to distrust in the healthcare system, distrust in health professionals. People are going to be isolated and alone. I think about the children who
I'm here.
I think about the children who were born during the pandemic or very young during the pandemic. You know, they're going to lack some of the social skills that the rest of us had. That we got from face-to-face interactions with people. You miss a whole lot of developmental learning by not having face-to-face contact with another human being. And so, you know, and then even when they do have face-to-face contact, people have masks on. And I'm all for people wear masks to keep themselves safe and keep others safe. But we're just talking about the impact of the pandemic. So we're going to see poor social skills, right? So, you know, I think a lot of the violence, you know, the gun violence is a lack of coping. There's no coping employee. We can't say it's a lack of coping because shooting someone is a way of coping. It's not an effective way of coping, but it is a strategy. It is a way of coping using aggression. And so we're going to see more of that. If we don't intervene in some way, in some critical and drastic way, and get a hold of our young people and help them to navigate their emotions and navigate their feelings, we're going to see more violence. We're going to see more suicides. We're going to see more mental disorder. That's my prediction.
Wow.
We have to intervene, and we have to use the technology. We have it, so we could use the technology to check on, you know, our kids or make ways, you know, have ways for them to check in with us. Before I met with you, I was in a webinar talking on mental health in the school age children. And this young lady who actually attempted suicide, African-American young lady, attempted suicide when she was in school because she didn't get the support that she needed. She created an app. And I'll make sure I get the real name of the app. She created an app for kids to download so that, you know, it's called I'm not okay. It's the Not Okay app. So where they click on this app and they're able to, somebody will reach out to them and it has a GPS locator system. So using things like that, I think is going to be one way of like kind of mitigating some of the mental disorder in our community among our youth.
Okay.